I really want this to be a time of engagement with all of you. So I'm going to be speaking for the first part of the session and then really open it to questions about what do you want to know, what's important on your heart, and how do we move this forward together. I'm glad that your university has such deep relations across the professions because no one profession is going to be able to solve this. We need to be able to work together and bring all our different talents, skills, and abilities into the same space and really, really move planetary health forward. So I think, Dawn, are you able to still click the slides? Ah, perfect. Okay. So I want to acknowledge that planetary health is a relatively new science and field. It's also a social movement, but it's an ancient way of knowing and being. And we give a lot of credit to indigenous peoples from the past, ancestors from the past, as well as indigenous peoples today, who have protected and lived in relationship, right relationship with the land and air and water, and have managed to not destroy it as they've lived in partnership. And so we have a great deal to learn from indigenous peoples around the world. Next slide, please. So today I'm going to be talking about some of the things that we're concerned about as far as the collapse of Earth's natural systems. We're going to be talking about 5 core domains of planetary health, education, and work, and then talk about some opportunities for health professionals in this space. Next slide. So a little bit about myself. I love nature. I've always loved nature. I've always looked at things in terms of patterns. I'm a pattern reader. I'm the type of person that as a child, I'd go down the beach and pick up agates after agates on Lake Superior. If I was at the ocean, I'd be picking up shells. If I was in the forest, I'd be picking up feathers. Everything was one large pattern to me. And I was a little bit disrupted when I got to school and you would study history and then the bell would ring and then you'd go and study geography and the bell would ring and then math. And everything was fragmented and pulled apart. And I couldn't quite understand how you can learn when everything's pulled apart because that's not the way nature and the world works. So next slide, please. So when you see things as interconnected in a great web of life, it's really a struggle when you walk across campus. And as I said, everything is separate. So when I found nursing, I was absolutely delighted because nursing plays on the playground of the web of life. We learn about all the systems, and part of the nursing paradigm even includes the environment. I know social work operates in a similar way. You cannot provide social services or social work without considering the environments that people live in and the communities and families that people live in. So we get it. We get it. This is not new to us. But something's happening here. I had an opportunity to study in the Kalahari Desert of Namibia, and I asked the San Bushman healers, I said, do you know what's happening on the outside? And they said, we do not know exactly what you're doing, but the strands of the web of life are growing very frail and are breaking. And so that's what we're going to be talking about today is these strands that hold us together and how they're breaking and how we can reweave the web of life. Next slide, please. So this is also a way of thinking that permeates social justice movements, and also Jennifer mentioned that the importance of that, and also other ways of thinking and knowing around the world. So this quote by Dr. Martin Luther King Jr. captures that sentiment. We're all caught in an inescapable network of mutuality, tied into a single garment of destiny. Whatever affects one directly affects all indirectly. Capture that sense of web, capture that interconnection of all of us together. Next slide, please. So these changing patterns began to become very concerning to me in that I began to recognize over time that we were seeing something happen that was not explainable. In the upper Midwest, which I consider all of us part of, Michigan and Minnesota, Wisconsin, this upper Midwest sector, our patterns were so predictable. People could plant by them. They knew that how much rain we were going to get a certain year because it was in a pattern. They knew how when to plant, when to harvest. But these patterns have started being disruptive. In my own lifetime, these are three stories I want to share with you briefly. One is that my birthday is in November. And every year, because we didn't have a lot of money, we went skating down at the local pond. So every November, the ice was thick enough to skate. Now in Minnesota, the ice generally on lakes is not thick enough till late December, early January. There is a change in the pattern. Similarly, as growing up as a child, I remember pushing my head against the window, the cold window of the bus, and looking as best as I could out the window for the first robin because as you know, and because you're very similar climate, we have tons of snow and very long winters, and the return of the robin was just such a good sign. And I would run home and we'd have a little celebration for whoever was the first person to see the robin. And I remember in the late 1990s, early 2000s in Minnesota, I noticed that the robins were not migrating. They were staying all winter. Something was changing the patterns. And finally, my ancestors are buried down in southern Minnesota. And I remember, and this is the day before car seats, remember as a young child sitting in the back of my grandparents' station wagon surrounded by big buckets of lilies of the valley and lilacs. And to this day, when I smell a lily of the valley or the lilac, I think of those times as a family, decorating the graves, telling stories, remembering our ancestors. But now those flowers, lilies of the valley and lilac, have oftentimes bloomed in early May. They aren't around to have the same traditions for my children and my grandchildren. So again, the patterns are shifting. So next slide, please. So, what is causing these patterns to break, these strands of the web of life to break? And the answer is that we are in the Anthropocene. That's the new geological era. We're coming out of the Holocene. We all have heard of Jurassic era, etc. We're coming out of the Holocene where things were quite stable. And the geologists believe that we have entered a time when the impact of humans is so extreme that we're actually altering the Earth's natural systems and disrupting the boundaries of life on this planet. So they've named the era after us. It's the Anthropocene. Well, that's not actually a badge of honor or a badge of courage. It means that we've messed up. And so we need to figure out how are we messing up and how do we rewrite these relationships. Next slide, please. And so, as a good nurse, I hopped in my canoe and paddled upstream. So, some of you have heard the story about upstream thinking and that whole messaging. It comes from a parable or a story about a village that lived by the side of a river. And one day, the village noticed a body come down the river, and the villagers waded out, and the person was still alive, just hanging on to life by a thread. They pulled him in. They provided food, shelter, clothing, fed the person, etc. And then two more bodies came the next week, and then it was more bodies. And finally, the chief of the village said, "We cannot continue to do this. This is not possible. We don't have enough resources or time or abilities to address this need. We have to get into our canoes and paddle upstream and see what's causing this." So that's the whole story behind upstream thinking. So I got into my metaphorical canoe and paddled upstream to say, what is causing these pattern shifts and this disruption of Earth's natural systems? And Anthropocene was the answer. Next slide, please. So we're doing a couple things that I think we need to call out and be aware of. For most of history, human civilization, the numbers of humans on the planet has been quite stable. And we've been really living in balance with the Earth's systems. We're a species that was living in balance. But ever since the started the Industrial Revolution and the burning of fossil fuels, we have been decreased death, which is a really good thing. We've increased agriculture production, which is a really good thing. We've decreased maternal morbidity, infant mortality, all of that. That's very, very good. But because of that, our population has skyrocketed. It has not been in check. And so we're living out of balance. And all of us today have the dubious honor, next slide, please, of having lived through the arrival of our 8 billionth human on this planet. And that was in November. So if you consider us an animal species, you wouldn't want rabbits to just mass produce and live beyond the plants and the food that were available to it. We similarly cannot live beyond what the earth is able to provide. So our population is a problem. And next slide. And lest you think I don't like humans, that's not the case. My daughter's delivering a baby next month, and I love being a grandma. But we are over consuming our Earth's resources. So it's not just the number of people, it's how much we consume per person. Ideally, you would take the number of people on the planet, divide up the Earth's resources that are renewable and produced in a certain year's time, and we would be living in balance, only using what the Earth produces is in 1 year's time. The last time we lived in that balance was 1970. I might say that date should sound familiar because it was the very first Earth Day too. But since then, we have been drawing down our bank account at a very alarming rate. And so if you look at this slide, it's when do we overshoot Earth's resources? And we overshoot right now about August is when we stop living in balance. All the rest of the months we're drawing down limited resources. And right now, when you add all of our humans together, we are using 1.6 planets or Earths to maintain our current level of consumption. That is not sustainable. And you might think, well, I know that COVID impacted things, travel decreased, etc. But if you look at the dark blue line here, with in 2020, COVID only bought us maybe 3 weeks on this chart. So it is not, we're just way over consuming. Next slide, please. And because of this, because of these things, these pressures that we're putting on the Earth's natural systems, all of these things are happening. Forests are being cleared at an alarming rate. Biodiversity is rapidly disappearing. Now, there is a normal pattern of extinction. Species come, species go. That is just what happens to life on the planet. But right now, we have an extinction rate that's 1,000 times normal, and we're losing species every day. Now, some of you might say, well, I really don't care if a certain toad disappears in, a rainforest. But you better believe you're going to disappear. You're going to be feeling the pressures when our pollinators disappear, when our birds and our butterflies are showing signs of stress and are disappearing, because that's the source of human agriculture. Our oceans are acidifying, land's becoming desert, air, soil, and water ecosystems are being polluted. I think last year was one of the first years that microplastics were actually showing up in the cord blood of fetuses or of infants. So we've got a problem here. We don't know exactly what microplastics and circulating in our bloodstream is going to do to us. It hasn't been, we don't have the science behind that yet. But that doesn't sound too healthy to me. I don't want plastic circulating in my bloodstream. Rivers are drying up. These extreme weather events. It used to be abnormal. Now the normal thing is that we have extreme weather events. These atmospheric rivers that California is experiencing, wildfires out west, hurricanes down in Florida, ice storms all through New England and also in Minnesota and I'm sure Michigan as well. And temperatures are increasing and sea levels are rising. Next slide, please. So I want to drill just a little deeper on climate change. It's just one of the problems that we're facing. So I don't want you to think it's all about climate change, but I do want us to understand some principles behind climate change. The Earth is in what I call the Goldilocks position. We are not too close to the sun, not too far from the sun. We're just right. In all things sort of perfectly designed to be in this beautiful space. And we have this very, very thin layer of atmosphere that protects us. And I mean thin. It is like a layer of paint when you look at the size of the Earth. And it is designed to allow the radiant sun from the energy, some of it to come through, and then most of it to radiate, excuse me, back out into space. But as you add particulate matter into that small layer, it begins to hold the heat inward. Now, if in Minnesota or Michigan, we're cold in winter, we pull up a blanket, we don't get warm instantly like this. We sort of chill under the blanket and eventually it warms up and we're nice and toasty. That's the same thing going on with the planet. We've added blankets, 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 and now we're starting to feel the warmth coming. And there's a 30-year lag time behind when we our sort of amount of pollutions in the air and the experiences that we're having. So we right now, all the storms, the crises that we're experiencing, the sea level rise, all of that is related to the level of greenhouse gases that were in the atmosphere 30 years ago. That means even if we stopped polluting today, we still have 30 more years of problems baked into the system already. So we talk about everything we can do to stop today is beneficial to the future. It's just that important. Excuse me, next slide, please. So over time, there have been these predictable fluctuations, and I'm showing you this slide because sometimes you hear people say, "Well, it's normal. There's always been hot times in the Earth, cooler times, glacial ages, et cetera, et cetera." That's true, and we know that because when you do glacial coring down in Antarctica, the ice shows bubbles. And those bubbles show how much carbon dioxide was in our atmosphere 800,000 years ago. That's how far back we can map it. And we know when the carbon dioxide rose up, the Earth got warmer. When it dropped down, the carbon dioxide dropped down, the Earth got colder, and you'd have glacial ages. And there was just this predictable pattern over time. Throughout history, the highest that we have gone is 300 parts per million. And that's sort of the part of this natural system. James Hansen, NASA scientist, probably in the late 1990s, met with Congress and said we can go up to 350 parts per million and still live somewhat the same quality of life that we have now. But look at this, folks. In 2019, our average was 409 parts per million. And next slide, please. And in February of this year is 420. We are not going in the right direction. So if somebody says to you, "I'm not worried, this is Earth's natural pattern," we should be going down towards the cooling right now, not skyrocketing towards the heating. Next slide. And this is based on science and data. You cannot argue with the data. So every 10 years, the National Oceanic and Atmospheric Administration, or NOAA, releases reports showing the previous 30 years collected data analysis of that. So look how the United States is warming. This is all based on numbers. This isn't conjecture or just stories. This is numbers, actual measurement of the temperatures. Next slide, please. What does that mean? Well, in Minnesota, it means that we are starting to feel the warmth. Minnesota, the actual name of our state, is a Dakota word which means the land where the waters reflect the sky. This was Minnesota over Minneapolis in July of 2021 when wildfires in the Pacific Northwest and the jet stream brought all that smoke right over Minnesota. This should have been blue skies. This is not sunset. This should have been blue skies, and this is what we had. But because we're used to clean air, our people were outside and didn't know there was a bad air quality days and were threatened. Next slide. So to take Minnesota off the hot seat and put you folks on the hot seat. Michigan's average yearly temperatures increased by 2 to 3 degrees. The states that are in the northern area are warming far faster than the southern areas. And this is from your own state. And you're also seeing these extreme heat episodes and extreme precipitation episodes as part of your lived experience. Next slide. And all of this has human health impacts. So not just climate change, but all these things we're doing to the Earth's ecosystem has these health impacts, impacting our cardiovascular statuses, respiratory conditions, infectious diseases, changes in patterns of vectors and zoonotic diseases, antimicrobial resistance, toxins, heat strokes, mental health effects, malnutrition, displacement and migration, civil strife and trauma. We have data to show all of these health impacts are occurring because of how we're disrupting the earth. Next slide. Again, in Michigan, these are your top related issues related to climate change and some of our earth degradation. Heat-related illness is your number one. Waterborne illness, respiratory diseases, vector-borne diseases, and injury and carbon monoxide poisoning related to severe weather events. Next slide, please. So this is my family album from this previous summer, over 2 months. My son got a deer tick bite in upper state New York and developed Lyme's disease. He moved back to Minnesota, got a second deer tick bite. I have to say he's a biologist, so he is tromping around the woods a lot. But he got a second deer tick bite and got Lyme's a second time. My little 2-year-old grandson was up on the North Shore and he got these little chubby legs down in the bottom are his legs. And he got a deer tick bite and got Lyme's disease. And then my pregnant daughter was at a local park, a local playground in the city, and she got a deer tick bite and developed Lyme's disease. This is one family encountering this. So when I say there's vector changes and changes in zoonotic diseases, I am not making this up. And we as nurses and people in the health professions need to recognize that this is happening today, right now, not in the future, happening right now. Next slide, please. And all of these events are creating an economic problem as well. $1 billion events. This is just 2022, 2021, 2020, all those years had these $1 billion events. So it's cumulative. Anytime your cities, your states have to rebuild infrastructure, have to rehouse people, have to rebuild roads, etc., that's less money to go going towards healthcare or other social services. So we have to recognize the economic impact of the things we're destroying as well. Next slide. And half the world's people live within 40 miles of a coast. That means that we are going to see significant migration. Most migration occurs within countries. Very little of it occurs country to country, only if a place becomes totally uninhabitable. But it puts stress on social conditions. So it's thought that the civil war in Syria had a lot to do with a 500-year drought that occurred out in the outer areas. People in the rural areas moved to the city. The city could no longer stabilize and support that, and civil unrest started. And so we're going to be seeing people relocate from even within the United States, from the shore dwelling people on and to other parts of the United States. Next slide. For example, here's New York. Take a peek at Manhattan. So we're looking at 1.5 degrees centigrade. Right now we're at 1.1, 1.2 degrees centigrade rise. And this is how much of the area will be lost if we reach 1.5. If we don't contain it there and we reach 3 degrees centigrade, the orange areas will disappear. Now look at those are our airports. JFK will be underwater. LaGuardia is going to be underwater. Newark don't buy land in Newark. It is gone. The whole city is gone. So we've got problem here, folks. We've got to be planning for this. The hospitals in these areas are going to have to move. The people in these areas are going to have to relocate. Next slide. And let's not even talk about Florida. Lower third of Florida is going to be gone with a 1.5 degree centigrade change. We're already creeping up there, folks. We're already moving on the move. So those of us in this work talk about if you emit, you commit. We can't back away. Whatever we're emitting today, whatever emissions we're creating, are creating this problem. And the choice is ours. We get to choose the future we want. And this is what we're looking at. Next slide, please. So it's projected that by 2050, 216 million people across 6 world regions are going to be moving within their countries. So we think we are struggling with migration now. We haven't seen anything yet when people are on the move globally. Next slide. And as Jennifer mentioned, um, it is those who contribute the least to the problem that suffer first and worst. And this is from a report from the EPA, from the Environmental Protection Agency in 2021. Black and African American individuals are 40% more likely to already live in places with higher mortality rates due to extreme temperatures. Black and African Americans individuals are 34% more likely to have problems related to childhood asthma that's caused by pollution. And Hispanic and Latino individuals are 43% more likely to lose wages related to extreme temperatures and outside work. So again, the people who have contributed the least to this problem are the first to suffer. And that is a justice issue. So when we talk about climate justice, solutions have got to work for everyone. They have got to lift everyone out of trouble and preserve everyone's health, not just some people's health. Next slide. So this is from the 2019 Lancet Countdown, from the executive summary. The life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food, and water insecurity, changing patterns of infectious diseases, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. That means that you as a nurse or you as a social worker are not going to be able to say, well, this doesn't affect me. I'm not going to be involved in this. Yes, you are. Every stage of people's lives is going to be dealing with these issues. So it's really important for you to know that and understand that we have got to be better at working in this space. Next slide, please. And this is what Antonio Guterres, the UN General Secretary, had to say when he opened the Congress of the Parties, or COP27, in Egypt this year. We're in the fight of our lives and we're losing. Greenhouse gas emissions keep growing and global temperatures keep rising. And our planet is fast approaching tipping points that will make climate chaos irreversible. We're on a highway to climate hell with our foot still on the accelerator. Humanity has a choice: cooperate or perish. It's either a climate solidarity pact or a collective suicide pact. It does not get more obvious than that. And that is now. It's not 50 years from now. It's not 100 years from now. We have got to make the decision now that we are going to have collective solidarity pacts. Next slide, please. So many of you are familiar with Greta Thunberg, the iconic Swedish activist. She was only 14 when she started her climate strikes and skipped school on Fridays and sat out in front of her nation's legislature with a little cardboard sign, and she launched a global movement. So if any of you feel like you're too young or too small or too powerless, I urge you to think about Greta. And this is what she had to say. Next slide, please. We can't save the world by playing by the rules, because the rules have to be changed. Everything needs to change, and it has to start today. Next slide. And that brings us to planetary health. So take a deep breath, because the story has not been fully written. It is not over. It is not doomed. It is not done. If we work together, amazing possibilities are here within our finger grasp. So that's what we're going to be talking about. We're going to be talking about planetary health and how we move things forward. Next slide, please. So planetary health, this is the official definition on the Planetary Health Alliance, is a solutions-oriented, I love that, transdisciplinary field, meaning that everybody's needed, and it's a social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. So we are on the move in planetary health. Next slide. Many of you are more familiar with the terms public health, eco-health, One Health, global health, and the UN Sustainable Development Goals. I am saying that planetary health is the big umbrella, the big overarching sort of tent that's large enough to hold all of this. So if you're heading towards being a public health nurse, keep going that way. If you love the idea of One Health or global health, fabulous. But join the tent of planetary health as we start to work on these issues together. Next slide. And I know many universities are working curriculum and topics around the Sustainable Development Goals. And so the planetary health movement is very, very closely linked to the UN Sustainable Development Goals, and we're working on these issues together. Next slide. So I want to talk briefly about the Planetary Health Alliance, which is a large organization at Harvard, which gathers together organizations from around the world who are dedicated and working on this topic of planetary health. And we got together and we designed a planetary health education framework for all students in higher education, no matter what discipline you're part of. All students, we wanted to create a shared language. So we began to say planetary health is really important, and we can only make these solutions when we work together. But it was really difficult to bring the different disciplines together and have a shared way of communicating, because nursing had its knowledge, and engineering had its knowledge, and agriculture had its knowledge. So what's the shared language we could all use together? We pulled together about 24 scholars from around the world, all from different disciplines. I was one of the nursing representatives. And the question was, what do all of our students need to know? Well, we listed about 500 things. Any faculty person knows you're not going to get people to put 500 things in their curriculum. So, but through a process of negotiation and working and collaborating and synthesis, we got down to 5 core domains. The first is interconnection within nature. It was very important to us to realize the whole thing's not going to work unless we redesign or re-embrace our relationship within nature. And it was not just humans are over here and nature's over here, and we somehow have to come in the same space, go to the same park, have a meeting. It's humans have got to realize we are nature. We are absolutely part of nature. And what we do to nature, we do to ourselves. It's all one major system. If you don't understand that, we will continue to deforest, exploit, mine, extract, all the things that have caused the problems that we currently have. We also need our students to understand the Anthropocene, and that we have to understand what humans are doing to disrupt the Earth's natural systems. In addition to that, we have to be focused on equity and social justice. We have to understand systems thinking and complexity, that you cannot create a change here without impacts in all the rest of the system. And how do we do that? And finally, our students need to know how to build movements. How do you move this forward? When we feel strongly about creating a healthier future, how do you build the movement to make that happen? So that's the Planetary Health Education Framework. Next slide, please. The other document is the Sao Paulo Declaration for Planetary Health. It's called Sao Paulo because it was supposed to be released in 2021 in Sao Paulo, Brazil, at the Planetary Health Alliance annual meeting. And we all know what happened in 2021, and we all know that everything went virtual. But we still got a declaration done, still a global declaration. Which was crowdsourced and crowd involved in drafting this document. And this is how it starts. We need a fundamental shift in how we live on Earth. what we're calling the Great Transition. Achieving the Great Transition will require rapid and deep structural changes across most dimensions of human activity. So this is not about putting band-aids on a problem. This is about really, really addressing the structures that have brought us to this terrible tipping point, and also how we rebuild for a better system in the future. Next slide. And the Great Transition is going to require innovation across all of these fields. You notice that I've circled or squared in purple the healthcare sector, in that we need to be working with all of these areas: food systems, businesses, urban planning. We need to be working closely with faith leaders and indigenous communities. All of this has to happen in order for this great transition to occur. Next slide. And this is what the global community calls the health sector to do. So in the Sao Paulo Declaration, there's a guidance for the business community, guidance for civic, community leaders, guidance for health sector, guidance for educators. This is what the global community said has to change in order for us to create this massive transition. So they want us to reorient everything we are doing and become nature positive, carbon neutral before 2040. We don't have a lot of time to do that, folks. We've got to get going. We need to strengthen the healthcare system's resilience and recognize these global environmental changes. We need to reorient our system towards prevention and health promotion. We can no longer wait for people to get ill and start treating them. We have to be prevention-focused people. We need to incorporate health perspectives and traditions beyond traditional Western methods, including traditional knowledges led by indigenous people, as well as other integrative health practices. This is our time to make sure we have integrative health experts in our communities, in our organizations, helping us move this forward. We need to promote green space as a form of health. We need to make sure that people have access to clean water, clean air, clean soil, that they have access to nutritional diets, and that access to healthcare is a human right. So this is the global call for change. I think we can do it. Next slide, please. So what are some examples of places and people that are doing things? At the University of Minnesota, we are changing our nursing curriculum. This is the year that in the next couple of years that all nursing school curriculums across the nation are redesigning their curriculum according to the new essentials. And so at the University of Minnesota, we have taken the opportunity to design a planetary health competency, and we are aligning our entire curriculum, every course, with content related to the planetary health education framework. And I have to celebrate our students, our DNP students, who came together and did that crosswalk that the faculty are now working with on our course designs. Next slide. We're also talking about nursing for planetary health, and what would that look like? And we've launched a global movement. We're working with the International Council of Nursing to produce a nursing for planetary health document that will be released at the International Congress in Montreal in July. So stay tuned, you're about to see it. But why ICN? Next slide, you'll see why. This is from the Code of Ethics of the International Council of Nursing. Nurses collaborate and practice to preserve, sustain, and protect the natural environment and are aware of the health consequences of environmental degradation. They advocate for initiatives that reduce environmentally harmful practices to promote health and well-being. This is who we are. This is our code of ethics. If I don't practice this way, I am not practicing according to the ethical guidelines of my profession. I'm sure social work is the same. Medicine's trying to catch up. I'm telling you that I've been sharing with some international medicine physicians, nursing's code of ethics, and they're like, oh my gosh, we don't have that. And it's like, okay, get started. So we are in this space already. Nurses are in this space. Next slide. We need to get involved in mitigation and adaptation, and those are two words that I want us all to be able to become fluent about. Mitigation is prevention, so we need to be working on decreasing our carbon footprints, decreasing our greenhouse gas emissions, decreasing our waste, such as medical waste, decreasing our pollution and the toxins we're pumping out into the world. We have to mitigate the damage that's being done, so have to prevent, including good policy work. But on the other side, until we get things leveled and improved, we have to help patients and communities and people adapt to the problems that we're causing. So we can't just be preventing and not take responsibility for all the damage we're causing. We have to do both, prevent it from getting worse, but protect people, especially people who I've mentioned that are vulnerable, either because of age or perhaps pregnancy or zip code, wherever people live, perhaps their employment. All of that has to be considered, and we have to help people adapt to these severe environmental episodes that we're encountering. Next slide, please. We need to hold our healthcare systems accountable. In the United States, our healthcare system is responsible for 8.5% of the US greenhouse gases. 8.5%. That's kind of crazy making. We're supposed to be saving lives, not contributing to killing lives. So we've got a problem here, and we need to fess up to it and say, okay, we've got to be part of the solution. If you took health systems all over the world and added those all together, and then put us in an order of the largest polluters as far as nations, we would be the fifth leading nation of greenhouse gas emissions. So we've got a problem here in healthcare. Next slide, please. And with all those problems, there are fixes. So we need to be looking at all sorts of things. We need to be educating our employees. We need to be reducing our products. We want nurses and probably social workers on every supply procurement committee in every hospital organization asking questions of, do you need to have this much packaging? Do you need to really have all these, different, things that get thrown away, cups and other, packaging. Do we need that? Can we buy locally and not buy less expensive, but we have to ship it in from China or some other place? We have to be smart about this and not be creating so many problems. Our food that's offered in our health system should be healthy food and should really model where we want people to go. And it should be accessible and at a low cost that all people can afford it. Make sure that our employees can get to work, perhaps with shuttles or some type of ride service. Really looking at our OR gas, not our anesthetic gases. Desflurane, which is one of the anesthetic gases, is, I can't remember what percentage, but hugely more dangerous than CO2. And so we need to look at decreasing the use of that or eliminating the use of that. Parts of Europe just eliminated the use of that. So we're on the move on that. Next slide, please. And support national policies and movements to change these things. The National Academy of Medicine is now has an action collaborative working on decarbonizing the U.S. health sector. I sit on that collaborative. If some of you are familiar with like the IOM report on To Err Is Human or Crossing the Quality Chasm, this will be issuing reports too. This committee will be issuing reports on how health systems can decarbonize. So that's coming. So what do we need you to do? We need you to keep the pressure on your health systems to say, we've got to move in this direction. This is our ethical and moral responsibility to not do more harm. Next slide, please. I invite you to become part of Nurses Drawdown. Nurses Drawdown is a project that we started a couple years ago. I sort of, the idea came to me when I was marching in the People's Climate March in New York City. I just had an orange t-shirt on. Everybody from Minnesota had an orange t-shirt on, but I carried a sign in the shape of Minnesota and it said, Minnesota Nurses for a Healthy Future. And what happened next just blew me away because people started coming off the sidewalk and they said, "The nurses are here, the nurses are here." And they took selfies with me and, "Oh, I'm going to send this to my mom and my grandma because the nurses are involved." And I looked around and I was like, "I'm involved." One nurse, but you better believe I'm going to get more nurses involved because nursing getting involved activated people's hope. So I began to think we are for the whatever 22nd year in a row the most trusted profession voted according to the Gallup poll, and we always outpace every other profession by like 15 points. It's not like little squeaky, we always win by a little squeak. We're so far ahead of other professions. So can we use that to leverage systems change? So I approached Project Drawdown, which has science-based solutions. I called them up, just a cold call out in Oakland, California, and said, "Have I got a deal for you? Do you want to use nurses to leverage your solutions?" They met as a board. They said, "Sure." And so Nurses Drawdown was born. And then the Alliance of Nurses for Healthy Environments, Katie Huffling, the executive director, set this whole project up, including nurses from around the world, and now it's a global movement. So you're invited to join and be a part of this. We want all nurses to teach families, teach their communities these 5 solutions in particular. We want people to preserve forests, plant trees, make sure that all our neighborhoods have green canopy to keep the temperatures cooler in the summer and to provide that fresh air for the people we care for. We want people to eat plant-based diets. Doesn't mean you have to give up meat totally, but really draw down your meat consumption. Educating girls is one of the most effective climate change solutions. And so we want to educate girls. That's an important initiative. Bikeable, walkable cities is another one that we chose, and renewable energy to decrease polluting energy. So all of these help restore the health of the planet, but they also help restore our health. It's not saying that we have a trade-off here of if I help the planet, I suffer. That's not it at all. When you help the planet, we actually live healthier lives and have a more equitable future. Next slide, please. And our students are watching. I don't know if your students have gotten involved in this, but I hope they will. Several years back, there was a University of San Francisco medical student. She was walking across campus. She could hardly see the building where she was at her next class because the smoke was coming from the wildfires across up in Marin County. And she got in, sat in her seat, and the topic was respiratory health. And not once did the professor mention the wildfires that were occurring. She got so mad. She was like, "How can you be so out of touch with what we're facing? You're not preparing us to be prepared health professionals." So she got together a group of medical students and they launched a Planetary Health Report Card, which grades medical schools on how well they're doing. There's now a Planetary Health Report Card for nursing, a Planetary Health Report Card for pharmacists, pharmacy students, and a Planetary Health Report Card for dentistry, is what I understand, is getting started. And it's student driven, student led, and student graded. So every year around Earth Day, we get our score, our grade from the students on how do our students think we're doing on our curriculum, how do they think we're doing on our research, on our teaching, and all the things we're doing at our schools. Now, the interesting point about this is you can leverage this because this is all public information. So I can look up the medical schools around the world and I can see, oh, Emory in Atlanta is getting an A. And then I am able to approach the dean of our medical school at the University of Minnesota and say, Dean Toller, why are we getting a C? What do we need to do to up that? Well, nothing impacts an administrator faster than students giving a failing grade or a poor grade to their school. So it's really a wonderful student-led movement. That's what I'm trying to convey to you, is you don't have to be hugely powerful. You don't even have to have your degree yet. All you have to do is to say, I'm going to start somewhere. I'm going to do something because every single one of us is needed. Next slide, please. So this is a picture of my grandson watching me when I gave a talk once, international talk. And the decision is ours. Which future do we want for the generations that follow? What decisions are we making that impact their lives? And don't be doom and gloom, because the decisions that are available for us to make will improve health care for all people, will improve the quality of our cities, will improve the relationships we have in and within nature. So now is the time to get going. Nurses, social workers, health professionals are never afraid. We step into what we're faced with, and we're going to lead change. Thank you very much, and I'll open it to questions.
Thank you so much, Dr. Potter. You always inspire me. So it looks like I can see one person. Jennifer has a question right now, so I will let her ask her question.
Great. Thanks so much, Dr. Potter, for a really wonderful presentation that was both kind of challenging and inspirational, right? About what are we going to do about it? So I really like the idea of making sure that we're challenging our university administrators to say, like, this is the grade of our municipality, this is the grade of our state, this is the grade of our university. Would you be willing to again share that kind of the link where we can find that information so that we can?
Absolutely. All of you will get a PDF of the slide deck, so you'll get my references and resources and all of that. So you can, have access to the PDF. It's the Planetary Health Report Card. So all you have to do is look that up, and you can see the 2023 results aren't in, but the 2022 results are there, and see how everybody stands. And it's a very sophisticated, data-driven report card. It's not just willy-nilly, throwing cards up in the air and you got to see. It is data driven. So it's hard to argue with it. And I am wide open to questions. If anything I said doesn't make sense, or you want to know more, or you want to know how it impacts your life or your work as a nurse, we're in a circle here. I wish we could just be sitting around a campfire and sharing stories and talking about this. But feel free to ask me.
I'm going to jump in on my phone now because I was getting feedback in the room. But what would you say are some of the top things that that future nurses, because we have quite a few future nurses, they're in their last semester of the nursing program here at Western, and what kind of things can they do as they're entering in practice to get involved or to change practice at the healthcare systems that they're working?
Sure, that's a great question, and congratulations to all of you that will soon be nurses. We need you and want you. So there's many things that I would put out there for you. One is that don't get discouraged if you find that healthcare is not uh, sort of responsive or leading this yet. It's up to all of us to knock on their doors, because there is a nursing shortage, and we're starting to tell hospitals that if you want nurses to work in your space, you need to be environmentally responsible. And so it's okay to give them a very strong message that what you're seeing is not acceptable. Or when you interview, ask them, are you doing some initiatives to address climate change and other environmental issues? That starts to plant the seed of what's going on here. Every new nurse is asking me this question, that they've got to get their act in order and be talking about this and working on this. Be informed, and so this presentation is just the very start of that, but be informed. You're going to be learning your profession. As soon as you get out there, you start the button on learning all over again, because now you're going to be in practice. So be merciful with yourself. I don't expect you to launch into some big setting up a green team or anything like that right away. Get the feel of your units, get the feel of your hospital, and then start to find who are allies that you can work with. I'm looking at Denise Irvin, who I know has done exceptional work on well-being and caring for us, because we can't do any work to restore the health of the planet if we're falling apart. So she's done remarkable work, and she is a Michigonian. Is that right? Is that what you're called in Michigan? And so look her up, look up her work, listen to her. She's presented at Sigma and other organizations, and find out what she's doing as a solution to keep us healthy, so that we can be involved in this work that's ahead of us. Find each other. Don't stop the door or close the door at nursing. Make friends and allies across the spectrum. We have social work here. You have physician assistants at your university. You have all the allied health professions at your university. Find those people and start to work together. So that would be the start of it. Oh, one more thing. Join the Alliance of Nurses for Healthy Environments and get on their mailing list, because they're our largest environmental nursing organization. And they have exceptional webinars. They have policy briefs that they put out. They have different committees you can work on. They have a fellowship program for nurses. So that's a great place to get involved. Other questions?
It's Dawn again. I was wondering, is there some place that's accessible to find out whether a hospital has a green team or is considered, um, you know, actively pursuing um, a decarbonization or trying to curb that? Do you have any information about that?
There's a couple organizations. Healthcare Without Harm is a wonderful organization that addresses environmental harms broadly. They always have a large conference once a year called Clean Med, which is huge, huge conference that deals with all these issues and has guest speakers. And then Practice Green Health is affiliated with Healthcare Without Harm, and they've got organizations can join, and then they get certain credentials by advancing. So I'm sure those organizations might have a list of hospitals or healthcare systems that are already doing this work. I'd like to call your attention to Providence Health System, which is out west. Dr. Beth Shank, or Elizabeth Shank, is just incredibly remarkable as a nursing leader in this space. So Providence is a large system. I think it covers 11 states, and she's the chief sustainability officer for that system. And they're going carbon negative. They've pledged to go carbon negative by 2030. So they're not even going carbon neutral. They're going to draw down extra by 2030, and that's their commitment. So they've done tons and tons of work on this. I have a DNP student who's it's not published yet, but she's done a wonderful project on helping her healthcare system measure its greenhouse gases and track that, so that they can actually start the drawdown process. What else? I would say those are all really good starting points, but don't underestimate the power of a telephone call. So to call a local health system and say, I am, I am tracking or looking at healthcare systems in our area. Do you have a green team? What are you doing related to environmental sustainability? Because that gets some wheels clicking. And the more that you call, if they get one call, they'll say, well, that was interesting. If they get 5 calls, they'll say something strange. And then if they get 20 calls, they'll go, something's happening here, and we better get going. So don't underestimate that as a way of creating change as well. Well, we've got a lot of silent people on this call. How many of you feel hopeful today? Maybe if you can find a icon to show a sign of hope, that you realize that yes, it's serious. There's no doubt about it. This is serious and it's urgent. It's not something we can put off for years and years and years. But is there hope that nurses and social workers and other health professionals can make a difference? Lots of thumbs going up here. Yes, it is hopeful. And you might say, well, then, Teddy, why didn't you start with the hope? Why did you start the story with the gloom and all that tough stuff? I'm here to tell you that if you jump too prematurely to rose-colored glasses, everything's hopeful, people will dismiss you. They'll say you are just, you don't get it. You're not seeing the truth. So you really do have to know what's happening. And you really do have to know how difficult it is and how, what a crisis we're in. And what I want you to know is that a lot of energy is spent going la 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 la. I don't see it. I don't hear it. I don't want to talk about it. When you are willing to say, okay, I've got to just sort of open up, take it in. This is really tough. I don't like it. I don't like it how it's threatening people. I don't like how it's harming my community. When you're willing to listen to the tough stuff, you go down into the depth of that and grieve what's happening. Grieve if we don't act together and join together, what's going to happen. When you go do that tough work, out of it, you rise with tons of energy because you're no longer having to use your energy to block your ears, block your eyes, and turn your back. Now you've got tons of energy to activate on this. So I started with the tough stuff. So you have a jump on going, okay, this is serious, and can move out of this into a more hopeful place and effective leadership.
So are there any other questions for Dr. Potter? And I did see if you have the comments open, I know they're open on our screen that I'm sharing. But Dr. Harrison had asked Denise if you would be willing to share some of your work with our group. We would love to learn more about your research and scholarship.
Sure. I completed a DMP project here in Michigan at the largest healthcare system, and the topic was fostering the recovery and well-being of nurse leaders, in which I used the intervention of stress first aid for healthcare workers and nurse coaching, combined those together to offer an in-person 8-week course to nurse leaders where we looked at their beginning of their awareness of what it looked like to take care of themselves, and then took them through an 8-week process with the curriculum and the education to then reevaluate where they are taking care of themselves, where they are taking care of their team, and implement well-being champions within the healthcare system. So they're currently continuing that forward. There is a group that are considered well-being champions that are nurse leaders, and they are implementing the coursework now into the leadership meetings throughout the remainder of the year. So they started in January and through December. The leaders were everybody from assistant nurse managers all the way up to directors. The CNO was my community partner, so she chose to opt out of the initial cohort.
So you in Michigan are lucky if Denise decides to stay in your state. You're very fortunate to have the soon-to-be Dr. Irvin in the midst of you.
Thank you. And I definitely would be open to answering any other questions. I've been on this track for well-being of the workforce since 2010, before I went back to school.
So Denise, if it's okay with you, you might, do you mind putting your email in the chat? So if somebody wants to connect with you, if you'd be up for that. Well, you'll be joining a community of fellow citizens around the world that are working together to create a better future. I urge you to take a look at the work of the Planetary Health Alliance. You can just Google it. You can become an individual member. Our School of Nursing has opted to be a corporate or organizational member. The next international meeting is in Kuala Lumpur in May of 2024. But it spans everything. The talks span everything from biodiversity, to protecting our oceans, to air quality, to indigenous ways of managing forests, to topics around human health and the impact of environmental changes. So it's a great organization to be part of. Tons and tons of information, lots of free resources, videos. So if anything I've said today sort of gives you, excites you, come be part of the movement, as well as Nurses Drawdown.
Thank you so much, Dr. Potter. So I will close questioning now, but I wanted to make sure that everybody that is seeking contact hours for this event. If you want to stay on just a few moments, I do have a QR code for, well, actually, if everybody could stay on for a few more moments, I have a QR code that will get you to a evaluation of this event. And we appreciate your feedback. And once again, I want to thank Dr. Potter for joining us. I feel so privileged to have you as a part of the nursing community and leading this charge of action in such a lovely and inspiring way. So I just cannot thank you enough. So yes. All right. So I'm just going to give me a moment to kind of get that QR code up, and bear with me because I'm going to have to close the screen and get the QR code up. So hang on for just a moment.
Take care, everyone. It's been nice spending an evening with you.
Okay, so I have it up. Sorry for the delay there. And hopefully I will close the captioning so you can get that. So I appreciate you taking the evaluation. And I believe we've already sent out an email stating that it may be until March 25th that we get the certificates out, but hopefully we can do it prior to that. So thank you so much. And once you take the evaluation, you are free to go.